does it say about the college co-ed Susan Fluke, who goes before a congressional committee and essentially says that she must be paid to have sex? What does that make her? It makes her a slut, right? Makes her a prostitute. She wants to be paid to have sex.
But, Dean, I wanted you to weigh in very quickly on this as well.
It's unbelievably despicable, and I'm also upset. Mitt Romney's response was, I wouldn't have used those words. No, Mitt Romney, get a backbone. You're running for president of the United States. You come out and say these words are despicable. They have no place. I think Rush Limbaugh, honestly, this is just like Don Imus's comments. Rush Limbaugh should be fired. That's it, plain and simple. He's made racist comments about African Americans before, horribly sexist comments, and this is the cherry on the horrific sundae that is Rush Limbaugh. Goodbye, Rush Limbaugh.
When I look around my campus, I see the faces of the women affected by this lack of contraceptive coverage. And especially in the last week, I have heard more and more of their stories. On a daily basis, I hear from yet another woman from Georgetown or from another school or who works for a religiously affiliated employer, and they tell me that they have suffered financially, emotionally, and medically because of this lack of coverage. And so I'm here today to share their voices, and I want to thank you for allowing them, not me, to be heard. Without insurance coverage, contraception, as you know, can cost a woman over $3,000 during law school. For a lot of students who, like me, are on public interest scholarships, that's practically an entire summer's salary. 40% of the female students at Georgetown Law reported to us that they struggled financially as a result of this policy. One told us of how embarrassed and just powerless she felt when she was standing at the pharmacy counter and learned for the first time that contraception was not covered on her insurance, and she had to turn and walk away because she couldn't afford that prescription. Women like her have no choice but to go without contraception. Just last week, a married female student told me that she had to stop using contraception because she and her husband just couldn't fit it into their budget anymore. Women employed in low-wage jobs without contraceptive coverage face this same choice. And some might respond that contraception is accessible in lots of other ways. Unfortunately, that's just not true.
People don't understand the issues that us poor people have to deal with every day. Birth control is very expensive every month, and some of us can't afford to even make an appointment or go get prescribed some. Birth control is a great way to help prevent babies from women of all ages. Would you want someone to get pregnant because they can't afford birth control? If they can't afford birth control, what makes you think they can afford taking care of a child and all expenses to come with it? I agree with Sandra Fluke. Birth control should be part of health care. It doesn't make you a slut or a prostitute. It just shows that you're trying to be safe. I don't see people who can afford getting birth control being called sluts or prostitutes when they're doing the same thing as us. They can just afford it.
Ms. Fluke would have the world believe that she is somehow a victim because she is at Georgetown Law School and is not getting her contraception paid for by the law school. When I went to law school, which I put myself through for $100,000 of debt, I didn't expect anybody to pay for my health insurance, which I had none of, no health insurance. And never once did I think of myself as a victim who needed somebody else to step in and pay for those things for her.
Why she's been cast as this victim is not because she's testifying and saying that insurers, employers, universities should pay for birth control. It's because she was called a slut and a prostitute for absolutely no reason at all.
Over my existence on this planet, I've learned that women will always be degraded. Throughout history, many women have died from ovarian diseases, those of which could have been prevented if the cost of health insurance was not so high. Contraception should be covered under women's health insurance. It is not only for prevention of pregnancy. Rush was completely out of line for calling Sandra a slut. Whatever happened to chivalry?
What does it say about the college co-ed Susan Fluke, who goes before a congressional committee and essentially says that she must be paid to have sex? What does that make her? It makes her a slut, right? Makes her a prostitute.
These denials of contraceptive coverage impact real people. In the worst cases, women who need this medication for other medical reasons suffer very dire consequences. A friend of mine, for example, has polycystic ovarian syndrome, and she has to take prescription birth control to stop cysts from growing on her ovaries. Her prescription is technically covered by Georgetown's insurance because it's not intended to prevent pregnancy. Unfortunately, under many religious institutions' insurance plans, it wouldn't be. There would be no exception for other medical needs. And under Senator Blunt's amendment, Senator Rubio's bill, or Representative Fortenberry's bill, there's no requirement that such an exception be made.
Who is Rush Limbaugh to say what's good and what's not good for women's health care? Sandra Fluke provided very valid topics when she wanted to get birth control covered by her school's insurance. And it's not like she's alone. Her, along with a bunch of other women at Georgetown University, are fighting for this law to get their birth control covered. Mr. Limbaugh said that she was a slut and a prostitute for wanting to be healthy doesn't make sense. How are other women, and along with Ms. Fluke, supposed to feel when they hear these comments about them? The comments were incredibly unnecessary and disrespectful towards women. She became a victim of verbal abuse from Mr. Limbaugh with these insults.
I have to say, you've been doing a number of interviews. You have shown extraordinary grace through all of this.
Thank you
had
very much.
Wanted to testify.
Yes.
2 weeks ago. Was it 2 weeks ago or only last week?
The time has lost track.
I've lost track as well, riding through this with you. And let's talk about how you felt, first of all. You were in our green room getting ready to come on, and the White House now tells us that we can reveal that you just got off the phone with President Obama.
Yes, I did.
The stakes have been raised pretty high, but what did he say to you?
He, he encouraged me and supported me and thanked me for speaking out about the concerns of American women. And what was really personal for me was that he said to tell my parents that they should be proud, and that meant a lot because Rush Limbaugh questioned whether or not my family would be proud of me. So I just appreciated that very much.
I'm sure this has been very emotional for you. I can't even imagine. You try to testify, you're excluded from testifying. We see that all-male panel, which was an amazing picture and a signal to the nation. The next thing you know, a man with a microphone reaching millions of people, perhaps the largest audience, radio audience here in the country, is calling you, vilifying you and calling you all kinds of names.
Yes.
And now you've had a call from the President of the United States.
There have been some highs and some lows, yes. So it's been quite a journey, and I'm just happy that what seems to be happening in the process is that America is hearing the voices of the women affected by lack of contraception coverage and who will benefit from this policy. And that's what's really most important to me. That's why I've been working on this for years.
You're a student at Georgetown, which is a Catholic, a Jesuit university.
Yes.
And there was a statement from the President of Georgetown today supporting you, embracing you. How important was that? He said, President DeGioia said, one does not need to agree with Sandra Fluke's substantive position to support her right to respectful, free expression. Rush Limbaugh and commentators throughout the blogosphere and in various other media channels responded with behavior that it can only be described as misogynistic, vitriolic, and a misrepresentation of the position of our student. Your Catholic university has, at the highest level, come out and endorsed your civil discourse, which is really what we're talking about here.
Yes, and I appreciate it very much. It means a lot to me. The support of the law school faculty as well as the president of the university has been very helpful. And I think it's really an example of what kind of model we should look to in our national discourse, because clearly the president of the university and I disagree about the issues, but we're both able to handle this in a civil manner.
I know there's a lot of politics that have been involved, but the President of the United States, President Obama, called you. I think it's fair to say you inferred from his conversation that he was reaching out to you because you've been victimized here by one element of the media.
Yes, he did express his concern for me and wanted to make sure that I was okay, which I am. I'm okay.
The Obama administration today is out to provide for the poor, middle class, and wealthy of our country. We need to develop a healthy environment for women around the U.S. Unwanted pregnancies and cervical health issues exist for women of all classes. Women and men need to advocate for better health care. How is that supposed to happen when a woman speaks up and is shot down with words like slut and prostitute? It's dangerous and demeaning. Women don't deserve to be shut down when all they want is a healthy lifestyle. Paying for school, rent, studying, and health insurance is a problem for some of us, and it seems that a select group of people fail to understand that.
Dance, 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 dance. Yo, what's up? You're now rocking with the best, Mr. C. Stop. Now make